Hey guys, this is Questions with Dr. Rob, where you ask a question and I do my best to give you the answer. So today's question comes from an anonymous person. They would like to remain silent in this episode. And their question is, Dr. Rob, I don't understand, what should I eat for Hashimoto's thyroiditis versus what should I eat if I don't have Hashimoto's and I just have primary hypothyroidism? What's the difference and what's the big difference in eating? Okay. Anonymous, here's the difference. So Hashimoto's thyroiditis is an autoimmune disease where your immune system is now attacking your thyroid gland. As a result, cells are getting destroyed. You're not able to produce adequate amounts of thyroxine or T4, thyroid hormone. And as a result, your body goes into a hypothyroid state. Primary hypothyroidism is when the thyroid gland doesn't produce enough thyroid hormone for reasons other than an autoimmune disease. For example, someone might simply have a deficiency of iodine or tyrosine, which is the amino acid you need to make thyroid hormone. And as a result, they can't manufacture thyroid hormone. So if you don't have any iodine, you're not making thyroid hormone because that's what thyroid hormone is made from. And if you don't have enough tyrosine, which is the amino acid you need to make thyroid hormone, you're not making thyroid hormone. You're going to end up with primary hypothyroidism. But this is not autoimmune. So the approach is different. When you have primary hypothyroidism, you want iodine. So you want things like dulse, kelp, hijiki. You want these sea vegetables that are high in iodine. You want egg yolk, right? Because that's good protein. There's good tyrosine in there as well. You want things like hemp seed, which is very high in tyrosine. You can utilize beans sometimes. So these are foods that are high in tyrosine. They're high in iodine. They assist the thyroid gland in producing the hormone. When we're looking at Hashimoto's, we don't want the iodine. We do not want the iodine. And the reason why is because the iodine accelerates the speed at which the thyroid cell works. And as a result, the immune system now hones in. It's like sending a duress signal. It's like when you put iodine in the thyroid when you have Hashimoto's, it's like beep, 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 beep. We got a problem. We got a problem. And the immune system's like, whoa, problem there. Let's go attack. Right? And starts attacking your thyroid gland. So we don't want to increase iodine intake. We want to decrease iodine intake. So we want to decrease the sea vegetables. We want to decrease to a degree our sources of tyrosine, but for sure iodine without question. Now, when we get back to primary hypothyroidism, we don't want too many cruciferous vegetables. Why? Because cruciferous vegetables, although they're anti-inflammatory and help us detoxify, they block the absorption of iodine into the thyroid. Often with primary hypothyroidism, there's not enough iodine, which is one of the reasons why this occurs, right? There's also toxins like bromine and fluorine and chlorine that could block the absorption of iodine into the thyroid. Mercury can do that as well. But regardless, we want iodine, we don't want cruciferous vegetables because cruciferous vegetables can block the absorption of iodine into the thyroid gland. However, in Hashimoto's, we do want the cruciferous vegetables. Why? Because it's blocking the absorption of iodine into the thyroid gland. And in Hashimoto's cases, we want that. We don't want a lot of iodine pumping in. We also want the anti-inflammatory effects from the cruciferous vegetables, which are great for that particular autoimmune disease. So, to recap, primary hypothyroidism, iodine, yes. So, sea vegetables, eggs, yogurt, cranberries, we want that type of stuff. Cruciferous vegetables, no, or smaller amounts for sure. So cruciferous vegetables are kale, cauliflower, broccoli, Brussels sprouts, bok choy, cabbage. We want low or no amounts of that in primary hypothyroidism. In Hashimoto's, we want no iodine or very little iodine. So no sea vegetables, no or limited egg yolks for sure. Limited sea vegetables, limited yogurt from dairy sources, limited cranberries, because these are things that are higher in iodine. Cranberries you probably get away with. And we want cruciferous vegetables because we're okay with blocking the absorption of iodine into the thyroid, right? So we want kale, cauliflower, Brussels sprouts, bok choy, cabbage. So I hope that helped. If you found it valuable, please click subscribe. Please share this with your friends and come hang out with me at the next Questions with Dr. Rob. See ya.